Bismillahirrahmanirrahim. Welcome to our anatomy videos, and we will start the clinical anatomy of the upper limb. Uh, First of all, we have to know about three very important concepts which related to the injuries of the upper limb nerves, which are claw hand, ape hand, and sign of benediction. The first concept is claw hand. The cause of the claw hand is the injury of ulnar nerve at the wrist joint. So whenever the ulnar nerve injured at the wrist joint, so the two muscles, which are lumbar muscles of digits 4 and 5, and all interossei muscles will be paralyzed. So as we know, the lumbar muscles actions were the flexion of the metacarpophalangeal joints and the extension of proximal interphalangeal joint and distal interphalangeal joint. So whenever this nerve injured, we cannot flex the MP joint and we cannot extend the PIP and DIP joints. So for this case, the metacarpophalangeal joints of digits 4 and 5 will be hyperextended because we cannot flex them because of the injury of the ulnar nerve, and the IP joints of the digits 4 and 5 will be hyperflexed because we cannot extend them. In this picture, we can see the claw hand, which is the injury of the ulnar nerve at the wrist joint. So whenever this nerve injured, the two muscles, very important muscles, which are lumbar muscles of digits 4 and 5, so they will be paralyzed. So as they paralyzed, they cannot act their works correctly. So there will be hyperextension of the metacarpophalangeal joints, which is this one, and the hyperflexion of the interphalangeal joints. These two joints are interphalangeal joints, so we cannot extend them, so they will be in an hyperflexion position. So this is the claw hand picture, and in this picture we can see the claw hand, that it is a damage to the ulnar nerve and it is a permanent position of the wrist, of the hand at the wrist. The second concept is about the ape hand or simian hand. This condition also occurs when the median nerve injured at the wrist joint. The median nerve at the wrist joint. So as we know, the median nerve innervated some muscles at the thenar eminence. So the two very important muscles, which are abductor pollicis and opponens pollicis muscles, so these muscles will be paralyzed. So as we know, the action of these muscles were abduction of the thumb and opposition of the thumb, in which the thumb moved medial and forward. So we cannot move our thumb medial and forward in this position. So for this case, the thumb will be adducted. The thumb will be adducted, and this adduction of the thumb is also the action of the ulnar nerve or the adductor pollicis muscle, which innervated by the ulnar nerve. So our thumb will be adducted, and thumb will pull into the dorsal plane with other digits. In this picture we can see the normal hand position and the ape hand. In normal hand position, if this is a plan which divide the plans of the hand into dorsal and ventral, so these two muscles, abductor pollicis brevis and opponens pollicis muscles, these muscles pull the thumb in ventral plane, and whenever these muscles paralyzed because of the injury of the median nerve at the wrist, so adductor pollicis muscle will pull the thumb at the dorsal plane, and these two muscles will be paralyzed. It is the ape hand condition. The last concept is about the sign of benediction, and this sign of benediction also is an injury of the median nerve, but at the elbow joint. So because the median nerve injured, so we cannot flex the muscles which are located at the forearm. There are two very important muscles which are flexor digitorum superficialis and the lateral half of the flexor digitorum profundus, which are innervated by the median nerve, so they will be paralyzed. So for this case, we are not able to flex the three lateral digits, and we can flex the two medial digits because the ulnar half of the flexor digitorum profundus is innervated by the ulnar nerve, and the ulnar nerve is spared in this condition. So we cannot flex the three lateral digits. The three lateral digits will be extended, and when the patient attempt to flex, the two medial digits can to flex. In this picture we can see the sign of benediction, that it is a median nerve injury and it is on active attempt to flex digits. So whenever a patient want to flex all the digits, or he attempt to fest the hand, so these three digits cannot to be flexed. Just two medial digits can to flex, because the two medial digits muscles are innervated by the ulnar nerve, which is spared in this condition, but the three lateral digits are innervated by the flexor digitorum superficialis and flexor digitorum profundus. So these muscles are innervated by the median nerve, and in this case the median nerve is injured. And in this diagram you can see the three conditions, which are claw hand, ape hand, and sign of benediction. The more important thing is that we have to know the differences between sign of benediction and claw hand. The most important difference is that the sign of benediction is not permanent. It occurs when we want to attempt to flex all the digits, in which we cannot flex the three lateral digits, but we can to flex the two medial digits. But claw hand is the permanent position of the hand, which occurs because of the injury of the ulnar nerve at the wrist joint. And ape hand is also the injury of median nerve at the wrist joint.